Good morning, friends. Today we are talking about the preconception counseling. I'm Dr. R. Godbole, working as associate professor in the Department of Obstetrics and Gynecology, D.Y. Patil Medical College, Kolhapur. Today we'll discuss about the preconception counseling. See, today we are in the world of modern obstetrics, where the pregnancy is planned. The age of the husband and wife both are working women, and it is a need to plan the pregnancy. If you are planning a pregnancy, we should think some preconception counseling, which is definitely helpful for the woman. So, what is this preconception counseling actually? So, the number of, if you see the definition, the number of interventions done to identify and modify biomedical, behavioral, and social risk to a woman's health or pregnancy outcome through prevention and management. Means we want a pregnant woman should be healthy before the pregnancy. She should remain healthy throughout the pregnancy, and her outcome should be good. And whatever intervention we need that we should do during the preconception phase. What are the importance of preconception counseling? What is the importance? First and most important thing is we want to improve the pregnancy outcome. At any cost, we want the pregnancy should remain throughout the pregnancy period should remain safe and outcome should be improved. We should reduce maternal morbidity and mortality. Third and most important is prevent infant morbidity and mortality. And fourth important is we should plan the pregnancy. This is a very important thing nowadays, how to plan the pregnancy and what precaution we should take. That is another important thing. Now, there are few objectives for this preconception counseling. Most one is healthy woman should become pregnant. The woman who want to become a pregnant must be healthy before the pregnancy. This is our first and most important objective of this preconception counseling. Second, mother and baby remain safe during pregnancy. Throughout the pregnancy period, mother and baby must be safe. That then and then only will have a good outcome. Preconception counseling is nothing but it is a branch of preventive medicine where we can prevent some complication before the conception. It includes risk assessment and education. Ideally, when we should do the preconception counseling, when we should call the woman for preconception counseling. Generally, it is found that any woman visiting to the doctor in a reproductive age group at any time, so any woman in a reproductive age group visit the doctor, we can counsel her regarding the pregnancy. Some women are having annual health checkup. We can counsel them regarding this pregnancy during this annual health checkup. PNC period. This is very important thing. She has already delivered one child, and how to have planned the next pregnancy. That is, we can counsel. This is a period when we see the women are in the receptive mode. Then next pregnancy test is negative. This is another important thing. Pregnancy test is negative. We should think, we should counsel them why it is negative and what we should do. Infertility treatment, another very important aspect. When the woman is infertility, having no issue, and she is undergoing treatment for infertility, counseling is very, very important. At any time for emergency visit, and lastly, premarital counseling. This is another important aspect of this preconception counseling. Pre-counseling, preconception counseling. What are we are doing is we are calculating the BMI, where we consider the height and weight of a woman. We take the detailed history, medical history of the patient, what disease she was suffering, or whether there is any history of chronic disease, medical disease she is suffering. Blood pressure is very important for a pregnant lady. The blood pressure we should record and should not be a chronic hypertensive woman. If any problem, we should tackle before she becomes pregnant. Systemic examination is very important, abdomen as well as pelvic examination. And very important thing, those women are high risk for sexually transmitted diseases. We should screen them for gonorrhea, chlamydia, and we are also screening them for HIV and hepatitis B. So this is a very important thing. These are the part. This is included in preconception counseling. What is the goal of preconception counseling? Ultimate goal for the preconception counseling is detection of the high risk factor. This is our, we should detect high risk factor during the pregnancy. We should take detailed medical and surgical history, whether she had any medical disease or she has undergone any surgical procedure, specifically regarding the uterus. Any, for example, history of mammectomy. Detailed obstetric history, how many living child she is having, anything about related with the pregnancy. Good obstetric career is very important before a woman should become pregnant. Personal history, as we take it routinely, family history, particular disease, general examination of a woman, and some basic investigation of the woman's, they are done. They are the main goal of the preconception counseling. Preventive health. This is another approach. Some of the conditions, suppose the patient is anemic, we should supply the nutrition so that her condition will be improved. Folic acid supplementation to reduce the neural tube defect. This is routinely done in a preconception phase, even after the pregnancy in the first trimester. We are giving the higher dose who are having positive history of neural tube defect in the form of spina bifida or encephalopathy. Something like weight reduction in obese patient, prevent preterm labor so that hypertension, treatment of hypertension, diabetes, control the diabetes, and history of previous LSS. These are all things is important in managing the successful pregnancy. Vaccination is another important thing. Those women particularly, other than the routine vaccination we are doing during the pregnancy, hepatitis B vaccination, women at risk we are giving, rubella vaccination we are giving to prevent congenital rubella syndrome. Specifically, those patients are highly susceptible. Uh, General investigation, what we are doing is, other than the routine investigation, what we do in a pregnant woman, we specifically look for HIV and STD, hepatitis B. We diagnose and we manage this patient. To reduce the risk of ectopic pregnancy, infertility, chronic PID, preterm birth, premature rupture of membrane, and fetal and neonatal morbidity should be reduced. We should screen the woman for medical diseases, some drugs, and some addiction that will definitely going to affect the newborn baby during her ANC period. So some of the chronic diseases where they are treated, but they will definitely have some effect on the baby. For example, if you think a woman is on the anti-epileptic drug, definitely this is under the risk. So we should think about those drugs should be prescribed during ANC period that is having less teratogenic effect. Diabetics, we should control the diabetic before she becomes pregnant. Hypertension should be controlled. Hypothyroidism, we should maintain TSH level less than 3. And regarding the cancer, very important thing regarding the cancer is here we are thinking about the fertility preservation before the treatment because we know this cancer drug or the treatment for the cancer will definitely affect the uh, ovaries and before the starting the treatment we should preserve the ovum so that after the treatment that is we can use that ovum for pregnancy. So this is fertility preservation specifically in the case of cancer. Suppose the woman is suffering from cardiac disease, we should find out the high risk patient of cardiac disease and pregnancy outcome is guarded. We should think which disease where the pregnancy we can avoid considering the risk to the life of the woman. Surgery for valvular disease before pregnancy or during pregnancy can be done. We should counsel the woman for congenital heart disease. Genetic problem. Parental karyotyping is required in specific cases. Carrying screening based on the ethical and family history. Suppose there is history of sickle cell anemia and thalassemia, then we should doing specific tests. Dietary advice, genetic counseling. This is also a important thing as a part of the preconception counseling. Counseling for teratogenicity may be in the form of drugs, which drug will cause the teratogenicity, chemicals, radiation, infectious diseases, or genetic factors. Obstacle to the counseling. Sometimes it is not so easy to counsel the woman because globally it is found that 38% pregnancies are not planned. And in the case of India, more than 50% pregnancies are not planned. They will visit the doctor after the pregnancy. So this is the main obstacle in preconception counseling. Indian women will definitely visit the doctor when they are sure about their pregnancy or they have missed the period. For this reason, all the women in the reproductive age group must be offered preconception counseling because if we think the pregnant woman should come before the pregnancy, it is not possible. So whenever we get a chance, we should discuss this preconception counseling with the woman in a reproductive age group. February is a pre-counseling health awareness month. Now it is considered as specifically 1 month as a preconception counseling. There are so many diseases category and their classification on the drug in the pregnancy. Some of the simple drugs that will cause in our routine practice, definitely teratogenic like alcohol, isotretinoin, phenytoin, diacetylmethystol, tetracycline, warfarin, and so many other drugs. So considering all these things, preconception counseling plays an important role in planning the pregnancy and with the good outcome of the pregnancy, mother as well as fetus. Thank you very much for quite listening.